Hey, beautiful. Welcome back to the D Cups Ups podcast. Today, I'm really excited about today because as you can see me. And usually our podcast is audio. And today we're doing something a little bit different. I have a guest coming on today that I'm very excited to share with you, my Busty homegirls with. So I'm excited. And he should be coming in soon. And we're going to be talking about pain, the pain that we deal with in our neck, our back, and our shoulders. As Busty girls, we walk around carrying melons, large melons, very, very large melons. And a lot of us deal with shoulder, neck, and back pain. And today we are going to be discussing how to relieve that neck, that back, and that shoulder pain. So I'm very excited to bring on our guest, and he should be popping in just a moment. Hello, Mr. Nasser.
Hi.
Welcome to the D Cups and Us podcast. So I'm very excited. I'm joined by Nasser Staples, a medical massage practitioner with over 20 years of experience in patient care, including emergency services, mental health, and physical rehabilitation. And he's also a Virginia State University alum, a former medical technician supervisor, and a massage therapy instructor. And he's now the director of massage services at one of my favorite places, the Waterfalls Salon and Massage Med Spa right here in Richmond, where he helps people heal from chronic pain, injuries, and everyday body stress using a deeply therapeutic anatomy based approach. And when I had my first appointment, let me tell you, it changed my life. So I've been a loyal client ever since. And to my busty homegirls, if you're currently dealing with tension, posture issues, or chronic pain due to the weight of the girls, this episode is going to open your eyes to what's actually possible and going to give you some relief. And when you start taking care of your body the right way, you're going to feel it different. So, Mr. Nasser, welcome to the D Cups and Ups podcast.
Well, thank you very much. So it's a pleasure to be your host on this particular show, and I think it's very important what you're doing and very vital to individuals' health. So I commend you for starting such a very important program, and hopefully this will be something that you will keep up for the betterment and wellness of each and every individual that really needs to hear a solution that's something natural and not medication based, so.
That's what I like. I like holistic healing. I'm not against going to the doctor. I feel like, that's necessary, but I'm also definitely someone who looks to alternative methods for pain relief and just things to help me just in general for my overall well-being.
Absolutely. I think more and more people, this is what I'm seeing, being a medical massage practitioner, is that more and more people are looking for wholesome things to heal their aches and pains and to really help balance out the musculoskeletal system and their mental faculties from stress, depression, insomnia, and other things. It's really all about educating your clients and showing them the right way of how to solve issues from a natural state of view. Because the body will heal itself. It just needs, sometimes it gets a little bit derailed and it needs to be put back in the right perspective so it can function. And then if we do our job by staying on top of things like stretching, walking, swimming, gymnastics, Pilates, and on to keep the abdominal area and the back area strong, we can help minimize a lot of things in a huge capacity if we just do our part as well. So
And you've helped me remove a lot of pain over the years. Like think I started coming to you about 2 years ago. I
mhm.
just did a quick Google search. Like I told you before, I did a quick Google search looking for a spa day for my birthday, and I found the Waterfalls Salon, and I came and I've been going ever since. So you've helped me a lot with the pain that I have, like just constant tension in my neck and shoulders, and you just help my overall quality of life, especially with the stretches that you give me. So that's why I wanted to bring you on so that you can give my busty homegirls some stretches as well, some things that they can take with them.
Definitely, definitely. I think by people getting educated, because most people have never heard of medical massage practitioner. or Thai massage, or if they have heard of Thai massage, they've never experienced it and the true benefit. A lot of people feel like a spa is just for relaxation. So having the educational value that I bring to my clients to help them benefit from on a natural state is key, is vital, and is very important to each individual that comes in. But also becoming an active listener, and not only being an active listener, but having a knowledge base to share with those clients, the things that they can do to stay healthy. So and then caring is also a huge component. You got to really care sincerely about each individual that comes in to see you, because people are relying on for you to tell them the truth and to help them from a natural state. And that's what we do here at Waterfalls Salon Massage Med Spa.
Yeah, and I feel like everything that you do is tailored specifically, especially like when I come, I feel like it's just like I'm the only one that comes. So you have like my own special plan. I just tell you I have a pain here, or I have a pain in my feet, or I have a pain in my back. Next thing I know, when I leave, I'm feeling like I'm walking on clouds. So I really love that you tailor the experience to each individual person, because everybody's different, everybody's stretch level, everybody's flexibility is different. And like I told you before, I thought Thai massage was when you walk on the back. That's what I thought it was initially. And when I had my first time massage, it was not what I expected, but it was definitely something that I love and that I'll always continue to get.
Good. Achiatsu, which is the one where they hold the bamboo poles in the ceiling, they walk on your back. Oftentimes, it'll get mixed up with Thai massage. Thai massage, although we both use our feet, but we use our feet and our bodies in different ways. So they are totally different in their own perspective, but they're both very effective. But I like Thai better because Thai, it just has more things you can do. You can bring higher depth into the relationship of an injury, or the tools that I give the client to really get down into the musculoskeletal system and to really solve issues. And I educate my clients too as I work on them, and I let them know, because you're right. There are different heights, different body sizes, different range of motions. All of those things are huge factors. So you got to work within the quarters of each individual and get them to where they need to be. But you don't want to take them from 0 to 100 within their first session.
Yeah.
But there are some professionals out there that will do just that. Not here at Waterfalls.
Yeah. Okay. Well, I did have a few questions for you. So, can you
Okay.
tell us a little bit about your journey and how you got into medical massage and this type of healing work?
Well, it's funny you asked that, because I was actually going to the dentist's office one morning, and the dental assistant was in massage therapy school, and so when she saw me come in, I don't know why she picked me. I guess that's how God sent you on your journey. She said, "Now," so she said, have you ever thought about massage? And I said, yeah, I mean, I've heard of massage, but I've never had one, and I don't really care to do it. And she said, really, I think you will be good at it. She said, because I feel that you will be genuine, and I think this will be something right in your alley. So she said, I ran into a financial crunch, and I'm not able to finish this semester, but I plan on finishing. So she gave me one of her books, and she said, go ahead, and she said, just look it over and think about it. So I put it on the shelf, and it stayed there and collected dust for about 6 weeks. So finally, I took it down, and I was just looking at the pictures. And I said, let me go and see what this massage thing is all about. So I went and got one. And surprisingly, the lady that worked on me was just an absolutely phenomenal. She was just really good at what she does. So I was like, I'm going to give this a little more insight. And I did. And I went and got registered in American Spirit Institute, which is where I went to massage therapy school at. And once I got certified, I was like, I think I can really do something. Even though I got certified and passed my NBLEX and everything like that, and I was legitimate, I just kind of danced around for the first 2 or 3 years, just kind of playing around with it.
Mhm.
And then finally, I ran into a lady that became a mentor to me. She really opened my mind, and I took it from there, and then from one certification to another, to another, and to another, and today I am about 31 years into therapeutic massage, and And I can clearly see by all the years of my training and the mentors that took me under their wings to mold me who I am today. Now I can clearly see the difference. There's a huge difference between an MMP and a typical massage therapist.
Yeah.
So, and that's been my journey and my and going out in nursing. I was in nursing for about 22 years. But as I was going through nursing, I saw a lot of people hurting in those treatment rooms, in their bedroom, unnecessarily. Even though I was a massage therapist, but I was still kind of a rookie in the field. And I was like, you know what? I'm going to push myself and become one of the best, so I can really change lives. Because God sent me through this journey for a particular reason. He put me in this spot to do God's work, and that's why I look at it. I'm doing God's work, and I'm changing lives, and
Mhm.
that's why I look at it.
Yeah, you're really helping people. And that's cool that you were a nurse and you were able to see people's pain and think of other ways to help them as opposed to just prescribing certain medications and just going along with what it says in a book, but you were finding different modalities to help them. That's really powerful.
Absolutely, and you have to. My Shemaya Chaw, she was the one that trained me as a medical massage practitioner, and she told me I don't know why she picked me, but she came over to we were on a break, and she said, "Now," so she said I've been kind of listening to you in the class and stuff like that. She said I can already see that you are already knowledgeable and stuff like that. She said, but when you finish this program. She said, never take a person all the way around Richmond and bring them back to the same damn conclusion. She said, just go ahead and take your knowledge. She said, hear them out first, evaluate them, and then go right to it. And that's been my strategy from day one. And then, of course, I have multiple certifications in different modalities, different expertise, and stuff like that, like pregnancy massage, medical cupping, Thai massage, combo massage, lomi lomi massage, which is a Hawaiian massage, and on and on and on. So, quite an extensive resume, but I'm proud of all my hard work. But the most important is changing lives and educating my clients so they can do better in their health.
Okay, so out of all of the areas that you could focus on, what made you most passionate, or what will be your most passionate area of focus? Is it chronic pain, or is it just helping people in general?
Well, that's a good question. I wouldn't say I have a particular favorite. I think the most important thing for me is seeing a person become less tearful and a bigger smile on their face and become out of pain. Those are the three most important components because there was a lady that came here and when she came into the studio before, with her first treatment, she was already in tears. So, having the ability to hear her out and then change her whole uh, health issue where she can truly function, that was the most gratifying part of doing what I do. It's just, see people that have been hurting for 6 months, 2 and 3 and 4 years, and then able to reverse that in just a couple of sessions.
Okay.
Having giving people back their lives to a certain degree and giving them tools to stay that way. That's what you want to focus on. That's the main thing.
Okay.
So I do have some of my modalities, to show you if that's okay with you.
Yes, I do. I do want to get into the stretches. I just had a few more questions, but I
Oh
wanted
yeah,
to ask
please do.
something specifically from your professional perspective. What happens to the body when someone has a larger bust? Like what's going on and what can create that pain from your perspective?
Well, having said females, they carry a lot of weight on the abdominal cavity. So when they have such a huge bust line, it's going to pull on the shoulders, the back, the rectus spinae muscles, which are your back muscles. It pulls on the spine. It pulls on the neck, causes neck pains, headaches, shoulder pains, you name it, and it's going to create headaches as well because by the gravity pulling everything forward. Of course, everything in the back is going to hurt. So by it rotating your shoulder, it's going to immediately rotate your shoulder. That's going to put pressure on this muscle here. It's called the sternocleidoid mastoid muscle. That muscle creates headaches on the top of your head, front of your head. It can dance with your eyes, lateral temporal headaches, posterior occipital headaches, and it can also cause it can mimic like a heart attack because it will put pressure. That this muscle will pull on the rib cage because it attaches to the second and third rib and then manubrium, which is the wide part of your sternum, and then it will press the nervous system, and you will think you're having a heart attack, but you're really not. When you go to the ER, they don't find anything because the weight of the chest cavity is being pulled down, and with the musculoskeletal system, but that taps into the nervous system, and that brings pain. So
Wow. So I never
lot lot
I've had
lot of
pain, but
things
I
can
haven't felt
happen.
like I had a heart attack
And
before.
that's not all of it, but that's just some of the things that can happen.
Mhm. Yeah, okay. That's definitely good to know, especially if someone is dealing with that much pain and they feel like they might be having a heart attack. Hopefully it's just, a muscle that they need to come and get. They need to come and get it.
Yeah, it's a
Hopefully it's
matter
that.
of you have to put the body back in the right perspective, and then the pain goes away.
Mhm. Okay. Yes. So, what posture habits do you see in busty women? What do you think that we can do just in our everyday life? Like when I work at a desk and I'm constantly at a computer and I can be slouched over. What can I do with my posture just in my everyday life to help with that pain?
Well, one thing is that all of us can do, whether you're busty or not, is strengthening the abdominis area, the abs and the back. That's critical and that's key in the process of women that have busty breast, where it's pulling on the musculoskeletal system. So one thing they could do is wall push-ups because everybody can't do push-ups per se. They just their arms or their thoracic cavity, meaning their abdominis and their back muscle, are not strong enough for them to go down and push back up. So your wall push-ups, you can do like 3 sets of 10 or 15, and then you build yourself up from as the time goes by, and as you get stronger. So putting your hands on the wall like so, with your feet apart, and then pushing, doing wall push-ups like that to strengthening up the chest cavity, shoulders, traps, abdominis, and the back area. Also, the butterflies, taking weight that's reasonable for the individual. Some people have 2 pound weights. It's not all about the weights; it's what you can handle, what your body can handle. Some people might have 5 or 8 pounds or 10 pounds. So you sit in a chair or you can stand, and you just have your arm and you have your chest out. A lot of people they do like this, and that's not the proper way to do it. So chest out, bring your arms up like this, not down here. I've seen so many people do it various ways. Arms are here, and you're going to bring your arms all the way in and touch your elbows together and bring your arms all the way back out like that. So you can do 3 series of 10 or whatever you think you can handle. Some people can only do 5, but that's okay. You can build from there. And you do 3 to 4 sets of that. So wall push-ups, butterflies, and you want to do it consistency. Consistency is the key. That's where people lack at. They'll do it 1 or 2 days and then they stop, or they might let 3 or 4 days lapse, and that's not helping the body strengthen where their shoulders will naturally stay back. You just delaying something that's unhealthy. Where you really should be staying consistent and never let anything like a cookout or things get in the way of you achieving your goal. Just two of the things, but there are many others, but those are just two of the things you can do that really do work. When I give my clients tools and things to use, they really do work. It's just a matter of staying consistent.
Yeah, so what I do is the stretches that you give me, I'll do them at night. I'll do them right before I go to bed. And so I actually set an alarm on my phone so I can remember to do my stretches. I'll do them at night, and then sometimes
That's
I'll
fantastic.
Mhm. So that I can make sure
Fantastic.
that I'm getting it in every day. And also, I'll probably even do some at work too. So if I have like usually I get there a little bit earlier than everyone else, so no one's looking at me weird. So I'll do it before. I'll do some of my stretches there.
If
So
they only knew. If they only knew.
if they only knew, right?
Yeah, yeah.
You wanted to show us, I know that you had some stretches and some things that you wanted to show us. Would you, do you have anything that you wanted to let us know? Things that we can also do outside of.
Well, the famous towel stretch for
Mhm.
the neck. And a lot of people, when they see me, when people come here and they see all the techniques that I use, they were like, I've never seen a technique like that. But the things that I do have been studied. I've done them 1,000 times. I use them on myself. But a neck stretch also is very good for increasing blood flow to your brain, keeping the muscular system in a relaxed state where your body can function. When your body is in a relaxed state, your brain just functions better. Your body and your thoughts and everything functions the way it should be. But if you don't have any tools and you don't have an outlet, you become trapped in your own mental world where it just frustrates you to the point where your anxiety becomes high, your blood pressure, your blood sugar can be altered. It makes you snappy and short when you're in conversations, and it breaks down your autoimmune system because you're in a state that you feel, but you don't have the tools to get out of it. And that's why people come here because I give them tools to keep them healthy along with the educational value. So one thing that I do is I like to carry a lot of humor too at times in my sessions, and I'm like, have you ever seen somebody take a $2 Kmart towel and do a whirl of good in your neck? And they start laughing. I said, I'm gonna show you how to do that. So typically, you just take a towel like this, a standard towel. You want to thin that towel out where it's gonna be nice and thin, like a rope. You're just gonna put it behind upon your shoulders like this, and you're gonna be sitting in a chair, or you can be sitting on the foot of your bed with where there's no distractions with your arms. So you're gonna have your body in an erect position like so. You're gonna grab the towel way up here. Now you don't want to grab the towel down here or down here because that's gonna make you lose power in achieving this stretch. So you're gonna bring your towel way up here on your trap like this. You're gonna pull straight down like this where you feel the pressure of that towel on your neck. And then you can't let the pressure go. You got to keep the consistency. That's a key word, consistency. And what you're going to do is you're going to lean your head all the way back like this as far as you can, and you're going to look right at the ceiling. And all you're going to do is just turn your head like this, real slow as far as you can. And you're going to do that about 10 times. It will, when you come down. Now, again, the reason you want to keep your eyes fixated on that ceiling because you want your eyes to be focused on one particular target. If you take your eyes off that ceiling, that stretch is going to be all over the place. Because psychologically, your eyes obviously tie into your brain and your thoughts because visualization makes a world of difference, right? But when you do that, you want to do 2 sets of 10. So over and back is 1, and then over and back is 2. But you got to just keep the pressure, but it makes your neck feel really good. It loosens up your scalenes, which is on the lateral side of your neck. Scalenes are where blood vessels come down on the lateral side of your neck, but it's also if you have a lot of tension, it will put pressure on those vessels, and that's what makes your fingers go numb, your wrist, other aspects of your body. So people they freak out and they think that they are having either a stroke or something, and it's not. It's tension cutting off the blood vessels and blood flow to the extremities. So by doing this stretch right here, it keeps those muscles loose. It allows the blood vessels to function properly, and it keeps you in a relaxed, good state because you're not feeling that pressure from all this stress that we get on our jobs every day. Of course, my job is not stressful. Mine is I enjoy mine, but it's not many people that do. Most people are in a job that that carries a lot of stress because you got You got the administration, supervisors, all of those things that play a major role. But if you have an outlet like this, like what our spa gives you, it keeps you in good graces and good health.
I like that. That looks like I'm gonna try that like probably after this
You,
episode.
you
That
you're
looks
gonna you're
very good.
gonna feel it right away.
And then that's
It's
something that
almost immediate.
you can do that like at your desk, so you can bring a little small Kmart. Well, it's no more Kmart nowadays, but you could bring a little
That's
small
right.
towel with you to work. Just drop it in your bag, and you can do that right at your desk before you snap
Well,
it.
actually, some of my clients even told me they was like, "Now, so you're gonna laugh at me, but I have a towel in my desk, and when I get a break and I go in the break room and I'll do this stretch right here." And I was like, "Hey, listen, it's you got to take care of yourself. Your job is not going to be thinking about your health. You
Hmm.
got to do it yourself."
Okay, so that's like
So
stretch for the neck. Is there any other stretches that you'll recommend for the neck, or would you recommend anything for maybe back pain?
yes, now back pain is different. Now, when you're dealing with back pain, whether you're like I said, whether you're busty or not, you can just a great back pain technique. You just lay it on your bed like that, flat on your back. Your feet are gonna be all the way down at the headboard, where the headboard is. You're gonna put your knees together, just like this. Let's say then these are my legs. You're gonna put your knees together. They're gonna be bent. Your feet are gonna be on the headboard like this, just like that. You're gonna put your arms way above your head, and you're gonna open your hands real wide. Now, it sounds funny what I'm telling you. Most people that like you, a physical therapist that see me doing what I'm doing, they might say, "Well, how does that change this thing?" Well, it changes things tremendously. So if I put my arms above my head and lock my arms out like this, with my hands real wide, and don't let your hands relax, you keep them wide like that, and rotate your body to the left or right, it's going to open up your rib cage. That increases blood flow through your serratus and intercostal muscles, which assists with breathing, blood flow. It's going to go to your lower back, so that's going to take care of your ligaments, tendons. It's going to help straighten out your sacral, which is your butt bone. It's going to help with your hip and your IT band, your iliotibial band. Your iliotibial band it runs right down the lateral side of your leg and it crosses over the knee. That is it's connective tissue. That's not a muscle. That's connective tissue. That supports the body when you're walking. It's designed to help support the weight when you're walking. So it takes care of that stretch, takes care of all those muscle groups in one shot.
Okay.
And so you want to any stretch that you do, you want to make sure that you include a stopwatch. So if you got an Alexa or if you got a stopwatch on your wrist, you want to sit there for about a minute or two while you're doing your stretches because the main focus is that you want to focus on the technique that's being given to you and not so much of counting. You never want to count in your head like 1, 2, 3. Your brain is going to be all over the place because your brain is trying to process what's going on and is trying to process the stretch that you're doing. But if you're counting, now I got to focus on the counting and the technique, and that's going to take away.
Yeah. Okay. Yeah, I've noticed that just not counting and actually putting the timer on my phone, so I don't have to think about that part. So that's been
That's
helpful.
right. That's right. And it's going to take away from your stretch because your stretch is going to be, like up and back and forth.
Okay. So what's one mistake do you think that us as busty women that we make trying to fix our pain? What's one mistake do you think that we
Sometimes, wearing cheap bras sometimes, because the gravity will pull it down further, and it's going to pull you forward further, even more so. That's going to bring even more neck pains, more headaches, more shoulder pains, more joint pains, more back pains, and all the above. So having a good support system in the bra area, also, like I said, strengthening those abdominals and back muscles are a huge component. There's also a good idea too, until you get strengthened, until your body gets to that strengthening state that it should be in by being consistent with the exercise. A good shoulder harness. I saw one that was really good, like a shoulder brace. You can wear that during the day, but you don't want to wear it all day because that can be a hindrance to your musculoskeletal system. So if you got to be at work at 8 o'clock, you might want to wear it from like 8 to 3, and then after 3 o'clock, you take it off. It's only geared to help your brain stay in a good state of posture where you won't be experiencing so many body pain. But again, you still got to stay consistent with those exercises daily to strengthen the body, the musculoskeletal system.
Okay, so Mr. Nash, you
So,
told us a lot of things. So you give us some stretches that we can do. And from just a rundown, it's important to take care of our bodies, make sure that we're strengthening our abdominal muscles, that what you said, our abdominal muscles, and then making sure that we're being consistent with our stretches. It doesn't take a long time to do. Just make sure you're doing it before you wake up, or not before you wake up, but once you wake up or before you go to bed. That's what I've found that helps me a lot. And also just making sure that we are being mindful of our mental state as well. And one thing that I
right.
always do tell the Busty girls is you have to get your bra fitting. You hit the nose on that one with about bras not fitting, because if the bras don't fit, it's weighing down everything and is
Mhm.
your posture is messing with, things they get to sagging even more if you're not wearing a bra that's fitting properly. So I have a lot of tools and resources for the Busty girls for that. So thank you for mentioning that, because that is definitely true, because I've experienced that, having bras that don't fit well, and it's caused pain because of that.
Mhm.
Yeah.
Well, even though we might be young, but the fact that you have a lot of adipose tissue pulling on the chest cavity, like I said, if you don't have a good support system, those are they can be a contributing factor to body pains and stuff like that. Free consultations are often we offer that here at Waterfalls Salon and Massage Med Spa. So if an individual may not want to take the journey just yet, they may want to just sit and have a conversation with me and share some of their health concerns with me, so I can talk with them, give them the right advice, set a date for them to come in and start the journey to a successful, healthy state of mind and physical body.
Okay.
So that's one of the things that we noticed that more and more people are starting to take care of. They always call is Mr. Nasser in? Can he see me for a free consultation? So I keep a certain amount of time in between each client, because some of my clients, they come in for a free. They come in for a 20-minute refresher, and a 20-minute refresher is something they can utilize, like if they run into an issue before they see me again. Most of my clients, they do pretty well. They can come in and they can get that done. Or if somebody wants to have a free consultation, they have that block of time. They can slip somebody in there to come in and have a conversation with me.
Okay. Well, thank you so much. We don't have too much time left, but I do want to do a quick closing rapid fire. And then after that, I want you to let us know how someone can book with you, how they can come and get their life changed and get some good stretches in. So I have a quick closing rapid fire for you. Some quick questions.
Okay.
It's one stretch every busty woman should do daily.
I would say one stretch that they should do daily is the one where they're lying on the one I just talked about, when you land on the bed with your arms above your head. One reason is because it's going to stretch out the thoracic cavity, the chest cavity, and it's also by you rotating your body from left to right, it's going to automatically strengthen your abdominis and your back muscles. It's just all, like I said, it's just all about being consistency and how serious are you about your health. That's the most important.
Okay.
Some people, they know they have health issues, but they don't take the initiative. So you have individuals like that as well.
Okay. Another question. One habit we need to stop immediately.
I'm sorry.
One habit we need to stop immediately as busty women.
One that we need to stop immediately is stop making excuses for ourselves, not to do things. You have an health issue or you have health pain, and the tools that are given to professionals like myself and others, you want to stop making excuses and be consistent, be diligently, and then losing weight too. Sometimes we can be overweight. I don't believe in the BMI, the body mass index, because I think that's for different cultures that I think is different. I don't think you can take that and utilize that for every culture, body mass index. That's, to me, that's your opinion. But we know as people and from culturally what we need to do for ourselves. And we just got to stay consistent and diligently and watch our weight and take that seriously and don't stop at Burger King every time you go by it, or McDonald's and all those kind of crazy things that have fabricated things in their food that will make you obtain water and weight and things like that. So sometimes, we all of us can get a little lazy kick sometimes. But some of us, they were like, well, I'm gonna stop by McDonald's or Burger King on my way home, and that'll be my dinner for the night. But it's also killing you too.
Mm-hmm.
So.
Okay, well, thank you so much, Mr. Nasser. I want to close out by you just letting us know how anybody in the audience can reach you, how they can book an appointment. So just give us any information that you have so they can stay in touch with you.
Okay. So to reach me is I work at Waterfalls Salon and Massage and Med Spa. The website is www.waterfallsalonandmassagemedspa.com. The number is 804-644-4002. So if anybody want a free consultation or they want to book with me, just call that number and let's make it happen and change your life forever.
Okay, and you're located in
We have two locations. We're also located in Glen Allen. That one has a studio built off the home. We do have clients that come to that one as well. I'm usually at that one at around 5:30, 6 o'clock to maybe like 8. But I'm mainly over in Bonaire, Chesterfield, which is North Chesterfield. So we are located in Bonaire, and just come on over and get yourself taken care of.
Okay, well, thank you, Mr. Nasser.
Welcome, and thank you for allowing me to come on your show.
Okay, well, you have a great day, and thank you for helping me and my Busty homegirls.
All right, be blessed.
All right, you too. Thank you.
All right, bye-bye.